psychological disorder. But what does it mean to engage in treatment? Well, when we think of treatment, treatment has its own understanding. There are three elements to treatment. You have to have a person who's struggling with mental illness. You have to have a trained professional, and there has to be some kind of interaction or work between the two. Now, the most important thing I'm emphasizing with the trained professional is those of us who are clinicians, we've gone to school for a long time to be able to do what we do. So it's important to be able to have a skill set. Being in treatment is not the same thing as going to your friend and asking advice. So therapeutic treatment is all about guiding you in a way that's going to help you with your mental illness. Your friends might give you emotional support, but they're not giving you therapy. They're not giving you treatment, if that makes sense. So I think that that's very, very important. Now, how we approach treatment might look different based on how we're trained. So I'm personally trained as a cognitive behavioral therapist. So I focus predominantly on how thoughts and emotions drive behavior. But each model of treatment might look slightly different. For example, historically, psychoanalysts wanted to cure their patients from some neurosis. So if you were to ask Sigmund Freud, he would say the goal of treatment or therapy is to take a person from a neurotic state and help them become quote unquote normal. Now, if you were coming from a Rogerian therapy model, so Carl Rogers, which is more client-centered or person-centered, the goal is we start with people who we view as normal, and we're trying to facilitate growth in order to help people reach their potential. So different schools of thought will operate based on different assumptions, but that will alter how treatment looks like. But every person that is providing treatment should be a trained professional, should be a licensed professional. Now, similar to I said, your friends can give you emotional support and give you good advice, but that's not treatment or therapy. The same thing can be said, the difference between group therapy and a support group. Think about that. Group therapy is led by a trained professional, whereas a support group is led by a peer. So if you look at the model for 12-step programs, so a person is in a Narcotics Anonymous, let's say, who is leading the meeting in Narcotics Anonymous? It is not a psychologist necessarily. It is not a social worker necessarily. It is another person who has struggled with addiction, who has started to learn ways to cope, and they're facilitating the meeting. But to facilitate or lead a 12-step meeting, you don't have to be a mental health practitioner. Does that make sense? So I want you to understand what qualifies as treatment and what doesn't qualify as treatment. So support
I have
groups,
a question.
yeah, go for it.
Um, does it? I don't get why it wouldn't qualify as treatment though, if they had experience and they kind of know what they're talking about the same way a therapist would kind of know what they're talking about.
Well, because I'll give you the answer. When we think of being in a 12-step program, you're going to give people guidance based on life experience, not necessarily what is demonstrated to work through science and research and evidence, right? So in order to be an independent practitioner, you have to understand models of treatment. You have to understand what interventions are going to work consistently. Just because a person has uh, acquired sobriety for themselves doesn't mean that they can give it away in the same fashion. And
Okay. Yeah, that makes sense.
they might also give you advice that is harmful to you. For example, I have done some substance abuse counseling, and one of the biggest challenges I face as a licensed professional doing substance abuse work is that the 12-step model operates based on complete abstinence, meaning you cannot touch any drug, otherwise, you lose your sobriety. And there are some people in the 12-step programs who include mental health medication, psychotropics. So they will say, if you take anxiety medication, you're breaching your sobriety. And if a person, in addition to using drugs, they're struggling with anxiety, now you're taking one tool away from them. So that advice is not clinically sound. So it's very easy for you to get guidance that's not based on evidence, not based on research and clinical studies and whatnot. Now, what I will tell you as well, Aaron, is that just because it's not treatment doesn't mean it's not helpful. When I do substance abuse counseling, I do I do encourage people to get in touch with a 12-step program, because there is a lot of good that comes out of that, even though it's not psychological treatment. Does that make sense?
Yeah, it does.
Perfect.
Thank you.
You got it. Any other questions?